All right, 9:27. Let's go back into the KUM newsroom room where we're joined by Lillian Posadas, and then we're going to get to John Thomas Brown, the man who wrote the book on procurement, literally. So, Lillian, thank you for joining us on this Monday morning. Hospital Administrator Lillian Posadas, as we just got word of another COVID-19 related fatality here, the 90th. Lillian.
Correct. Hi. Good morning. Good morning, Chris.
Good morning.
Good morning, Jason and Sabrina. Good morning, Guam. Yes, we just lost another individual early morning. And so, yes, and our condolences and our prayers to the family. Our census right now in terms of COVID, we are at 70. Of the 70, 15 of them are on the ICU level of care. And of the 15, 11 are on ventilator support. So our numbers are creeping up in terms of individuals needing ventilator support. So it's an indication that, the conditions of these individuals that are coming in are quite acutely ill, quite severe in terms of their respiratory system, that they need them ventilator support. Of the 70, 12 of them are up at the CIF. Total number of individuals that we have transferred out of this acute facility over to the CIF, it's now about 85. And so, it's another good sign that people are healing and are recovering. And so of the 85 that were transferred to CIF, many of them have gone home or to the ISOFAC, government-sponsored ISOFAC. And so we have 12 remaining at the CIF as of this morning.
Any additional staff?
So that's where we stand with our COVID situation, our COVID census.
Any additional staff flown in to provide assistance?
It's hard to hear. I don't know if since the sound, the audio is getting kind of, either that or my age, my hearing is.
Probably both. I'd say it's 60-40, Lillian.
Any additional personnel flown in to assist in the last few days?
I think about 3 of them came in over the weekend. 3 additional staff, RNs.
Okay. Regeneron arrive yet?
We haven't heard. We haven't heard that they have arrived. And so, we'd like for the community to help us out on that one, because it is an outpatient, regimen, a treatment regimen that is administered to individuals within their first 72 hours of onset of symptoms to prevent them from going into the acute stage. And so we'd like for the community the clinics to help us out and not let it be again with GMH, but it would be great if a clinic, with an urgent care service, just to make sure, because this is it's an infusion, it's a transfusion. And so we want to make sure that, the processes and the protocols are there if in the event the individual has a reaction to the Regeneron. So it'd be good to have it where there's an urgent clinic service.
So the way it would work is that HHS would ship the Regeneron to GMH, and then GMH would provide it to the private clinics, like I guess the tier clinics.
I'm not sure that it's going to be delivered directly to GMH. That we haven't gotten that detail. It might go to public health, and public health will be the one to distribute it to wherever the site is going to administer it. So again, we haven't gotten a whole lot of other details regarding the Regeneron.
Okay. Still the one Blue Med tent up? Have you had to put up any other Blue Med tents? Or just the one?
Yeah, we're still just one for now that we have right outside of the emergency room. So we're using that as a fast track, for patients to be seen, evaluated, and then a decision by the clinician to say whether or not the individual needs to be admitted or, can be released home. So that's what we're using the Blue Med tent for, fast track.
Lillian, can you tell us about the morgue capacity there at the hospital? How are we doing on that?
Okay, the morgue right now with the CME, the Chief Medical Examiner's morgue, it's full. We have, I believe, 2 in our morgue, open spaces, and so we're hoping that the funeral homes will come and, transport the remains for, a burial and funeral services. We do have that reaper that's right outside of the CME and the hospital, that it has. I believe there's like 15 remains in there. So again, if the funeral homes will come and, pick up some of those remains bodies so that they can be given proper burial and funeral services, that will help.
Did you ask about the staff?
No.
Has any more staff tested positive for the virus since the last time we spoke?
Not this week. We have a total of 86 employees since the second wave that have tested positive, and majority of them have been cleared. I believe 5 are still out on isolation, and of the 5, 3 of them are registered nurses, staff nurses, still out on isolation.
Anything else, Lillian? Do we have any additional fatalities other than the 90th that hasn't been released yet?
No, hopefully not.
Yeah.
That's the last one, the 90th that we know of.
Right.
We haven't, not since midnight last night.
A tragic weekend.
So hopefully we have more.
Right.
What was that?
Yeah, tragic weekend with just the number of deaths that we had over God, it's like every weekend, every day.
I know. It's unfortunate. It's sad. So really we try and, save them. Try and save them as best we can.
Lillian, we got a lot of reaction with the interview we did with you. I believe it was last week where we read some of the posts that were put on social media by some of these outgoing nurses who had come to Guam to assist with the COVID-19 effort. Man, I'm still getting comments on that interview. I know you had got emotional. What was the staff reaction to those posts and that interview? Did it kind of give a little boost to the staff who I know is just so overworked with this pandemic?
The comments, what you have read,
Yeah.
yes, it really gave them a boost, encouragement, gave them a lot of encouragement that, what they're doing, what they're risking their lives to take care of these patients, definitely, increase their hope and the sense of hope and faith that, what they're doing is really very heroic, very courageous of them to, continue caring for these individuals that come into the hospital. So it was very inspiring, very encouraging. So thank you for sharing that.
Of course, thank you. Thank you so much for your time, Lillian, and for the accessibility that you give us and coming on the show and just getting these numbers out to the people.
Well, we're we just want to help the community understand that, the severity of this COVID, and hopefully that they continue to do their part to wear their masks, keep their distance, and wash their hands.
Right. And just as a small token of our appreciation, if you look behind you, Lillian, we've prepared several beer boxes worth of virtual banana donuts.
Okay.
Okay.
All right. I like the Bonilla Saga.
Yeah.
That sounds good.
Okay. So please try my recipe, okay?
I will. I'm going to enjoy it.
Thank you,
Bye.
Lillian.
Bye.
Esther. Okay.
Bye.
All right. Just doing our part, just doing our part. 9:36, we'll take a quick break, and we're coming back with the man. I just love saying it, Jay, the man who wrote the book on procurement. It just sounds legit, right?
That's a great thing to have on your LinkedIn profile.
Right.